Good morning, hello, and good evening to everyone. My name is Mayumi Kako from Hiroshima University. So I'd like to introduce Dr. Gary Glauberman. So he is an assistant professor and director of the Advanced Population Health Nursing Program at the University of Hawaii at Manoa School of Nursing. He is dual board certified in advanced public health nursing and disaster health care. Dr. Glauberman's research focuses on the impact of the environment on population health and health disparities. His specific area of interest is on community preparedness for public health emergencies, such as disasters and large-scale communicable disease outbreaks. So we'd like to welcome Dr. Glauberman, and then please start your presentation. Thank you so much.
All right, thank you, Mayumi, and thank you, Andrew, for that that introduction, and thank you to the WADEM Nursing SIG for hosting this talk today. My name is Gary Glauberman, assistant professor at UH Manoa Nursing, and today I'm going to present on the topic of the Maui wildfires that occurred in 2023, August, and I'll also tie that into some research that we're doing regarding perspectives of some of Hawaii's most disaster vulnerable populations. And so here's what we'll be talking about, exactly about the factors that led to the disaster in 2023 with the Maui wildfires. I'll describe this term that is in the title, what and who are the Indigenous Pacific People communities, and describe what their impact was with the Maui wildfires. Then I'll turn to some family emergency preparedness barriers that these populations face in Hawaii, and we'll discuss some potential interventions or strategies designed to improve family emergency preparedness among these groups in Hawaii and other places in the world. I guess first off, I should describe Hawaii in general. So if you look at this slide, you can see where we are. We're a tiny archipelago of islands in the middle of the Pacific Ocean, right in the middle of North America and Asia. And our state, one of the states of the United States, is composed of 8 major islands. And our University of Hawaii is here in Oahu Island, where Honolulu is. The international airport is here. And we'll be talking about Maui, another island that's over here in the state. Some things that are significant about our state is that our state is an extremely diverse state for the United States. We're a state of immigrants, so many Pacific Island immigrants and Asian immigrants make up our population. So extremely diverse, and you can kind of see this in our student population here. This is the school that I teach at, the University of Hawaii at Manoa School of Nursing on the main campus. And some things that we love to do in Hawaii are surfing, and today the surf is excellent. I'll be talking about Maui and the Maui wildfires. So here is Maui. It's one of the major islands in the state of Hawaii, and it is famous for the Haleakala volcano, beautiful beaches, the humpback whale season, and also Lahaina town, which we'll be talking about in more depth. But Lahaina was a very culturally and historically rich place in our state. And to put this all into context, in the United States, we had an extremely busy and tragic year in terms of disasters. In fact, we had a record-breaking year of disasters in our country, 28 disasters, more than any in one year. And each of these costed over $1 billion each. And you can kind of see the constellation of different types of disasters. Here's the Maui wildfire. So putting this into context, disasters are increasing and becoming increasingly complex and expensive in our country and likely in the rest of the world. And then here in Hawaii, we're extremely concerned about disasters. We have extreme geographic isolation, as you saw. So our populations can't depend on neighboring states or other jurisdictions to help us during disaster. So we have to be a little more self-sufficient in terms of preparing and then responding to emergencies. And then we have really unique climate risks as well, very high risk of sea level rise, and then different types of shifting weather patterns are really concerning for persons in Hawaii. So I'll shift to the focus of this Maui wildfires. So on August 8th last year, the wildfires occurred, and what you may have seen in the news is really focused on the fire that occurred in Lahaina. But to put it all into context, there were multiple sites where the fire was active on Maui, three major areas where there are populations living in risk areas. And you could see the fire areas on this map, and also provided by NASA Space Agency, showing the scope of the fires that were occurring on August 8th. These fires started very, very early in the morning, right past midnight on August 8th, and they continued to burn throughout the entire 24 hours and even beyond into the next day before they were fully controlled. So this is a very long, prolonged period of fire emergency happening on this island. And to give you some context of the impact of the fires, this was the worst natural disaster that has ever occurred in the state of Hawaii. And it was the deadliest wildfire in the United States in over 100 years. Currently, when I collect this data last week, 101 persons had lost their lives, more persons were injured, and they're expecting there to be $4 to $6 billion in damages. You can see the extent of the areas that were involved in the fire. About 1% of the entire island of Maui were impacted. And most significantly, Lahaina was where the tragedy was concentrated. Most of the casualties occurred in a very tiny neighborhood of Lahaina, and I'll explain kind of factors that contributed to that. But we see that most persons who lost their lives are in a very concentrated area. Lahaina specifically was an extremely significant cultural and historical site. It had long history of the Native Hawaiian kingdom before the Hawaii became a state. Long ties with immigrants who had moved to Hawaii for 100 years prior, and many cultural significant sites that were still there to this day, which have been lost, and the county and the communities are still grieving over this loss. As of this data collection, there were over 3,000 homes that were destroyed in Lahaina, and there were over 3,000 people who were still living in hotels in lacking permanent shelter. And so this is still ongoing. The fires had occurred about 8 months ago from today, but this is still an ongoing recovery effort among the communities here. To kind of give you a sense as to what contributed to this disaster, I'll give you some sense of the natural hazards and as well as other challenges that occurred during the fire. So prior to the fire, we were under a hurricane watch in Hawaii, and Hurricane Dora was occurring south of the state, and that caused really high winds that were occurring at the state. So we were under a windstorm advisory, and we could feel the effects across the state, but specifically in Lahaina, very strong winds were occurring prior to the fire. And then leading up to the fire, the months ahead of the fire, we had record high heat. As some of you may know, 2023 was the hottest year ever recorded for our planet, and we were experiencing record high heat here in Hawaii, which led to drought conditions across the islands, and especially in Lahaina, the West Maui area. So these were contributing to the fire risk hazard of the island before the fire happened. And then when the fire did happen, the fire was extremely unpredictable because it was fast moving, being blown by these hurricane winds. and the heavy smoke caused by the fire really made it an extremely challenging environment for the people involved trying to evacuate, as well as those trying to involved in the response. Also making this a very challenging situation was the damage or debilitation of the critical infrastructure of the island. So one of the major challenges was that there were many impassable roads because of the hurricane condition winds. We had fallen utility poles and debris, for example, as you can see here, roofing, pieces of buildings being blown off of the houses and blocking roadways. And so both evacuation out of the areas and ingress into the areas that are exposed to the fires for emergency vehicles were severely hampered by these situations. And then also during the fire, the responders and persons who were evacuating described extremely poor visibility due to the very heavy smoke, making it very difficult to drive and leave the area. Another thing that was happening at the same time was because the utility poles had fallen, a lot of the area had lacked any electrical power. And so that impeded, people were not able to use their cell phones. They could not call, they could not charge their phones, and the internet was down. Also, emergency communications were also impaired by the power outages. And then also, one of the major issues with evacuation was the heavy traffic. And part of the reason why there was heavy traffic was because of the power outages. The traffic signals were not working. So it caused a really terrible congestion of cars on the road and confusion when some areas that were blocked, people had to make U-turns into very congested areas again. So this is a very challenging situation that evolved throughout the day. Other challenges were related to the emergency response. So because of the heavy winds, the firefighting capacity was diminished. They're not able to use their helicopters to douse the fires with buckets of water as they may usually do. I mentioned heavy traffic, so this impeded both evacuation as well as emergency vehicles. And then I mentioned in the beginning that this was a fire that occurred over 24 hours. And so during that time, the fire slowly closed in on this population area of Lahaina. But before then, people were being evacuated to the Lahaina emergency shelter. And so when the fire was starting to approach Lahaina City, we had to see a major evacuation of the Lahaina emergency shelter, which sustained a lot of damage in the fire. But this process of evacuating 1,000 people who had come to the emergency shelter was a major undertaking. Many of the persons that showed up there did not have their cars, and so they had to bus people out of that area extremely quickly. And then another thing that made a challenge for evacuation and overall response was that the emergency sirens were not used to alert residents. And this was stated that because people tend to believe that when there's an emergency, sirens go, that they would go away from the ocean because the sirens are often used for tsunami alerts. So the decision was to not use them because hearing them may cause people to go towards the fires. This is what was believed at the time. And so because of that and other factors, what we have learned was that people in the fire zones were really unaware of what's going on around them. And police that were sent to evacuate persons in their homes found that the persons that were still in the homes were not aware that they're in the line of the fire moving towards them. And then even when they were told that the fire was coming, many of the residents were very reluctant to leave their homes, understandably so. But this really delayed their evacuation out of the area. Um, Another challenge is that has been identified that there was a lot of misinformation that was being spread around online. There's this rapid spread of online information that was purportedly to disrupt the integrity of first responders, the community, and the government. And this is from the Maui Police Department report, some pictures from their report showing some examples of misinformation or disinformation that was sent out to confuse the public about what's actually happening. And these were found to be false. And then to give you some context as to what's going on in Hawaii and why this was such a challenging event for us, there are many vulnerable groups that we have identified, especially coming out of the COVID pandemic. Persons who, as a group, did poorly in terms of health outcomes during the pandemic. And these are namely the Hawaii's Native Hawaiian, Pacific Island, and Filipino populations, persons who are descendant of these ethnic and racial groups. And we use the term Indigenous Pacific People in Hawaii when referring to these groups in aggregate. And generally, these persons, we all know in Hawaii that they disproportionately have poorer health outcomes due to many social economic factors. Some that you see here, they have these groups tend to have poorer health, more economic and housing instability, poor access to healthcare and social services, and often have language and cultural barriers when interacting with public health and community services. And so we know this in Hawaii. These are groups that we tend to look out for and provide services towards. But in the context of the Maui fires before, during, and after, we're finding that these groups had extreme language barriers when trying to access services for evacuees and people trying to recover, especially the Filipino populations and the Pacific Island populations. We're finding that housing is a major challenge to recover on Maui. Many of our Indigenous Pacific peoples in Hawaii live in extremely large households because the cost of living in Hawaii is so high, so that some households have between 12 to up to 24 persons living in one home. And when their homes were lost, there really is not a lot of places to house persons after the fire. So this has been an ongoing challenge in Hawaii and Maui, trying to find places for these people to live while they recover from the emergency. Another interesting and challenging factor related to recovery and response was the immigration status of the persons. Lahaina specifically had a lot of immigrants that came to work there, and some of them are non-US citizens, making some barriers on getting some of the recovery resources that are available to the community there. And so that's been a continuing challenge for victims of the fire. And then employment is another major one. The Lahaina city specifically was a very tourist-centric town. With the fire having destroyed most of Lahaina, the people who are affected are both out of a home and also out of a job. And so they're not able to recover without employment income. And this is another challenging area for the community right now, and especially for our Indigenous Pacific people, who many of them have worked and supported the service sector and the tourism sector in Lahaina. So these are ongoing challenges that are occurring right now. And we're learning about this each day. We, at our school at the University of Hawaii, we're always looking for ways to better improve services. And specifically, my research has looked at how to improve emergency preparedness. And we had conducted a study regarding how to better prepare Indigenous Pacific peoples for natural disasters that may occur. And so before the fire occurred, we had conducted a qualitative study which was meant to explore perspectives of family preparedness among the Indigenous groups that I described earlier, and with the hope of identifying potential interventions that we could use to tailor our services and our efforts towards these groups that we know are at high risk. And so this study occurred in October 22 through March 23, and it was a qualitative study, mainly because there had not been a lot covered about this topic in previous literature. We involved female caregivers of children aged 0 to 12 years old in this study, and who were patients of a community health center on Oahu. And these are persons who identified as Native Hawaiian, Filipino, or Pacific Islander. And this study was approved by UHIRB. And the way that we collected data is here. We had telephone interviews with a semi-structured script for based on the health belief model. And we record and transcribe the interviews. And this is how we collected and analyzed the data here with descriptive analysis and content analysis for the qualitative data. And so I'll give you a brief description of some of our study findings in context of the Maui fires, and I'll give you a link for the full study in the next few slides. You can kind of see here that our group had focused on persons, a larger group of them were 30 to 39 years old, and Pacific Islander were one of the major groups here, besides the Filipinos and Native Hawaiians. And some of the highlights from here really echo what happened on Maui, so are quite pertinent to how we go forward from this disaster. And we found that, no surprise to many in this room, that there are major social and financial barriers that families face when they're trying to prepare themselves for emergencies. And this is something that we did see during the Maui fires. Here's some quotes from the study. We don't have any transportation, and both of our parents are disabled. And then related to financial resources barriers, once you see the emergency preparedness checklist, you say, that's going to cost too much. I don't even want to do it anymore. This is pertinent to Hawaii. In Hawaii, we recommend households have 14 full days of supplies available to them to be self-sufficient after disaster. And that's in contrast to the continental United States, where it's recommended to have only 3 days. And we do this because of our geographic isolation. So it is definitely a financial burden for persons in Hawaii to prepare for emergencies. Some of the suggested interventions that came out of our study were healthcare-based interventions. You can see that families would like a yearly emergency preparedness checkup with their provider, especially when there's a child checkup. And then they believe that that's helpful because the healthcare provider will know their patient, and incorporating emergency preparedness into every visit would be helpful for them. Other interventions were community-based, such as storytelling about emergencies. So real-life stories would benefit the community, so people will open their eyes and have a new perspective, as well as school-based interventions as well. And then one final group of suggested interventions was a technology-based interventions, where persons in this study suggested a website with customized checklists for their family would be awesome, or a local app that we can use that's more catered to us. And in this thread, it was found that the information that is provided by the state, by the national FEMA or CDC, is too generalized and is sometimes not pertinent to exactly the family's needs, making it very confusing for persons to prepare themselves for emergencies. So looking for something that's more tailored to their family was important. And so the plan is, having come out of this terrible disaster and having this research, to use the information we gain to inform new interventions to boost family emergency preparedness, especially among specific at-risk groups, as well as using emergency preparedness interventions based in healthcare clinics, and developing new technology-based tools that would help personalize family emergency preparedness guidance. So that's what we're working on right now. We're putting together a federal level grant to fund this type of research. And so in closing, we kind of all know here that there are many factors that are magnifying the impact of disasters locally and globally, both within the natural environment as well in the social, and that social and economic factors really negatively impact the ability for families to prepare for emergencies despite the increased risk, and that contributes to greater health disparities among vulnerable groups. In Hawaii, that would be the Indigenous Pacific people, but that pattern probably plays out in many different ways throughout the entire world. And that we as healthcare professionals within our own clinics, we can capitalize on this moment to work towards increasing the number of people who are prepared for emergencies within their own homes, and especially helping them with evacuation plans for wildfires and other natural disasters. And I emphasize evacuation plans because these cost nothing to community members. So trying to overcome that perception that I can't prepare because I don't have enough money or space in my house, at least starting with evacuation plans would likely have helped a lot of people during the Maui wildfires. And that's one way we can emphasize emergency preparedness in a very frugal way for persons who don't have financial resources. And that's the end of my presentation. Here's my contact information. Here's where I work every day. I'm sitting in this building at the University of Hawaii at Manoa. And I'd like to thank my research team here, Marissa Dela Cruz, Melvin Kamba, Philmar Mendoza, and Dr. Fontenot for their support for this project. This project is also funded by a grant from the PICO Center here in Hawaii. So a mahalo to them as well. And I guess I'll take questions from now. Mahalo. Thank you very much.
Okay, thank you so much for your presentation, Gary. So I'd like to start taking a discussion. Before that, I think there's some questions and raised from the audience. So today you have so many participants. So from the literally globally. So I'd like to say thank you for the Gary's presentation again. So the first question is coming from the Caroline person. Thank you. So what do you foresee as the biggest challenge with recovery now and into the future? So I guess you mentioned some the recovery period and the challenging. So would you like to a little bit elaborate to answer that, please?
Yeah, I guess the most pressing thing in Hawaii is housing. And so this is a major challenge that is being taken up at many levels at the community and the state level. And we're getting support from the federal also, the federal government. But because the homes that were lost were multi-generational, like I mentioned, and to replace the amount of housing that was lost with new housing, it'll take a lot of time. The housing costs are much more expensive. These were older. This is a very old community, and so to rebuild will cost a lot for individuals and families. And so what we're concerned about is this loss of the housing, people moving out of the area. The cultural and historical ties will be lost because of that, and it'll be very challenging for persons in that area to recover in that way. So that's one of the major ones. Yeah, I'll stop there.
Okay, yeah, thank you so much. Because I'm quite surprised that one whole, that 12 to 20 is quite large people living. So I imagine that, that the providing housing after the recovery, how, government with the government support and individually, maybe the financially, challenging. So how you balance to promote that, recovery to live, like before the fire is quite challenging, I imagine. Okay, so thank you so much for your answer. So second question from Anthony Fong. Thank you. So I might have missed it. What was the source motive of the misinformation around the fire? I guess we hear this kind of misinformation everywhere that after the disaster, even that the conflict. So what do you think about that?
Yeah, I'm not an expert, Anthony. but I could point you to the reference that I pulled these slides from, which was the Maui Police Department, who worked in collaboration with the FBI in America. So if you'd like to go to this reference, and we'll send out the slides later, you can see it. It was pointed out that there may be some foreign governments and other persons that were providing misinformation. So please do look at the reference to see they made some suggestions as to the motive. But I do recall having, been watching the fire live. There was a lot of very confusing things online, and because the response was moving so quickly, it was really hard to verify all these things. And like anyone in the group that has responded to an emergency, you know that rumors fly during disasters, and these things are just kind of amplified now with social media to new audiences. So yeah, take a look at that, and I hope you find some answers there.
Okay, thank you. Okay, so next question from Diana Group. Thank you. So her question is, can we have reference to study on the preparedness for Indigenous for Hawaiians? So yes, that's the last slide that Gary provided. So yeah, and then kindly he provide the QR code so you can read it, and then straight away you can access to it. Okay, that's great. Thank you. And the next question is, many primary care officers are not prepared for disasters or to reduce their patients or themselves. I think this is more commentary. So maybe you can put into the question. So, that you are the specialized, more public health coverage, the background. So in your insight, what do you think about the, preparedness for the primary care providers in Hawaii?
I think so. I would probably agree with you, Deanna, that if you were to ask a primary care health person, it's probably not one of their priorities because they have multiple priorities, and maybe they haven't thought about preparedness for themselves or their patients. Though I would say, coming from this study and a previous one we did on parents of preschool children, parents of young children really trust their healthcare providers. They'll trust them for vaccine recommendations, and they'll trust them for emergency preparedness. That's what we learned. And so we're missing out on a really great opportunity to interact with people about emergency preparedness. And one of the examples, suggestions that came from this study was to include emergency preparedness checkups when you are doing your child annual health check. So for example, if a child is going to start school and are going through their vaccination list with the healthcare provider, that would be an excellent time to talk about evacuation preparedness as well, or family reunification plans. And so that came from our study, and I don't think it would take much more effort from a healthcare provider to ask these questions, or at least pose them to the families. What have you thought about if you were to be displaced from your child during an emergency? What would you do to get reunited? So it would take 30 seconds. Yeah.
Yeah. Okay. Thank you. Yeah. Yeah. Do you want to add some more?
That's all. Yeah.
Okay. Yeah. Okay. Thank you. Yeah, I totally agree. I think it's for the recovery phase. I think it's to look back and what happened, and then the primary carer in the communities first, that we can talk more, person to the carer to the family. So I think it will be a really great opportunity to keep a conversation as well. Okay, thank you for great insights. And next question from Don Luca, thank you. So he's talking about more, the burn center capability. So what happened to the Hawaii Islands? 7 subsequent injuries or trauma and respiratory affected the healthcare capability. So he's asking how's those areas, especially related to wildfire, so burn center capability look like in Hawaii.
Yeah, I'm sorry, I wouldn't have data on that, Norm, though I know anecdotally stories that I've been told that we had to convert a lot of our hospital units on Oahu to increase capacity for burn victims. So these are victims, I'm sorry, these are hospital units that were not traditionally being used for burn victims, were upscaled to take in the large number of burn victims that were transferred from Maui to Oahu. So that's one way that we help to cope with that surge capacity.
Yeah. Okay. So, how's the transport? Is it airlifted more
Yeah,
likely? Yeah.
yeah.
Okay. Thank you. So, right. Thank you for your answer. And Sam, from the Sam, to Ruth, thank you for your question. Then he asking it's pretty much, I think it's commentary to finding is pretty much common in other parts of the world where poverty and the socio-cultural disparities are similar to Hawaii. So how hopeful are you that our effort will help reduce disaster damages under the current conditions and long-term climate change forecast?
Yeah, it's a good one. Thanks, Sam. Yeah, it's a good one. And yeah, I'm hopeful because if I were not hopeful, I would not be doing this work. So I do think that because of the awareness that climate change has, we have a lot of data now linking climate change to health, and we have terrible outcomes of what change in the climate looks like. I am hopeful that greater awareness of these linkages between climate change and health and our understanding of health outcomes and social determinants of health, the linkages, I'm hopeful that more people will pay attention to these linkages and will have added knowledge and resources to address this in ways interprofessionally that we haven't in the past. Yeah, so I remain hopeful, Sam.
Okay, thank you. Yes, and the next one is from Maria du Rio. Sorry, if I no correct pronounce it wrong. So aloha, Dr. Glauberman. My name is Maria, and then she's from Native Hawaiian, born raised in Hawaii. So she worked formerly at Strobe EL, and my grandfather's ohana are from Maui Lahaina. One issue I didn't hear raised within this study with the community was the correlation between environment impact, both leading up to contributing to the fires, which included water diversion practices and the supplanting, of native more fire resilient vegetation, as well as the long-term impact that arsenic, lead, and other hazardous chemicals in the soil and water. There will continue to have on long-term recovery efforts for the community there. So thank you for your mahalo for your great presentation. So I think he's talking about more
Yeah,
environment and
absolutely. And Malia, mahalo for this comment. And we don't have the scope to describe here the contributing factors of environmental justice and man-made factors that have altered the environment over time. But I think one thing that's important is the culture here in Hawaii. If you've lived and grew up here, we have this term called aloha aina, which is really recognizing that people are dependent on the environment and the environment is dependent on people. And so ingrained in a local culture here is the respect for the environment. And I agree with you that we cannot have disaster mitigation without greater respect for the environment and being better stewards of the area around us. So it's not about just, protecting our homes to protect ourselves from natural disasters, but we really ought to be broadening our perspectives of how we're caring for the land around us including, removing of invasive species that led to the brush fire, caring for the water streams also. These things can be done in the broad aspect of disaster mitigation, but really it's just being responsible for the environment around us. So that's a much longer conversation, but I do appreciate the perspective, Malia. Mahalo.
Okay, thank you so much. Okay, so we have another few questions. So from Richard Hernandez, thank you. What measures could have been implemented to mitigate impact, and what proactive steps are being taken to prevent such widespread damage?
Mm.
So what do you
Yeah.
think?
Oh, thanks, Richard. I don't know what the proactive steps might be right now. We're kind of in the recovery and evaluation phase, and this is one of multiple reports that are coming out regarding the response to the disaster. We did have a very similar incident in 2018 on Maui with a hurricane preceding a fire, and that was quite catastrophic as well. And in the report in 2018 were some suggestions on how to mitigate the impact of wildfires on the community. And you can read there in 2018 some of the things that could have been done to mitigate this disaster. So I do hope that coming out of these reports that we're learning about the current fire, that we really implement the things that need to be done early on and learn from it. And I do believe that this time is different. We know that we're at higher risk now because of the changing climate, the drier temperatures on all the islands in Oahu, and then we've seen the terrible impact that these fires can happen. So I really hope that we take the preventive action that is being described here.
Okay, thank you. Yep. Okay, thank you. So next question is from anonymous, but the question is, how do you plan to support them? Them is, the community. This person is a primary care physician and public health physician. So from their perspective, so how do you plan to support them if you are asking them to do emergency preparedness in addition to the work that they are doing? So I totally understand. You have your own work, ongoing now, and the kind of, you have to top of that. So I think the person is asking, how do you do that?
Yeah, I can't fully understand, but I can empathize as a nursing educator having to be asked to do more and more and more despite having a full plate already. But I would say that there are certain things that could be done in the primary care setting that are very cost effective, very cheap to do. It could be done by staff. We've worked with our federally qualified health center here locally, and they identified that their medical assistants that are preparing for the visit and talking to their patients in the downtime. There's some opportunities to patient education, putting up flyers to bring awareness to emergency preparedness. So that's some small suggestions, but I think really changing culture around preparedness and not just being reactive is a longer term project that needs to be done, not just in primary care. People cannot just hear about emergency preparedness once a year and be expected to take care of their family. So community-based interventions alongside school-based interventions that realign our culture towards mitigating and reacting to disaster, I think is really necessary in Hawaii and probably in other places around the world. So thank you.
Okay, thank you. So another question from Graham Dot. So in the immediate healthcare response, was the majority done by hospital-based providers, community-based providers, or both?
I don't have the data on it, but I believe both. We had a major, our state has a very well integrated healthcare system. All the hospitals are interconnected with each other. They communicate through an association and can coordinate. We really honed that ability during the COVID-19 pandemic. And so they're able to shift resources and manpower when needed across the state. And then at the community level, there's great outreach from community-based organizations, community health centers, the American Red Cross, the food bank. They were all mobilized for many months, and are still mobilized in some ways. So a lot of service had to be coordinated across the board, acute care and community, and still ongoing.
Yeah. Okay, so I think relating to the recovery phase, the next question is mental health impacts, how being experienced and what type of psychosocial support were able to provide or planned since the disaster. So what do you think about this area in the post-disaster?
Yeah, I've not been directly involved in the psych mental health support, though I do know it's quite robust. For being on the ground, there are mental health professionals within the community, and then there's also telehealth support also being made available. But we do know that this is going to be a long-term effort for the mental health support, as I described. The loss of major cultural and historic artifacts and buildings and things like this that were deeply tied to families that have been there for over hundreds of years, right? These will take a long time, and maybe some people never recover from. So we know that there's going to be a lot of need for mental support in the future, mental health support. Yeah.
Okay, thank you. So I think that some comments are still being provided, and so we might pick up some comments from there as well. So, but I think there's another question left. So from Lester, what risk reduction practices are now being pursued in the wake of your findings? So if you have any insights for that.
Right, not directly related to the research. The research is brand new. But we conducted 2 studies at the same time. I didn't describe our quantitative studies today, but we're using both findings from our research to develop an intervention that will be community informed to help build some technologies and apps that families could use that are, they're individually tailored. They'll use GPS to describe exactly what is the risk for a household in a specific neighborhood, and if they're given certain members of their household, what are their specific needs during disasters. And the hope is that our technology will develop a family-specific emergency preparedness plan that one person could take on one sheet of paper and carry out those actions on their own. So these are some of the ideas that we have coming out of these studies that we are twin studies. But thank you.
Yeah, that's great. Okay, thank you so much. So we had all questions answered now. So yes, this time, that the session is planned for 1 hour, but since we don't have any other questions, I'd like to start closing. We had so much participation today, and thank you so much for your participation, time to listen to Dr. Gary's presentation. I'd like to thank you again for his presentation, Gary, Dr. Glauberman. Thank you so much. And we had so much insight from the, since the August, we hear a lot of news about the Hawaii, the fire, but we don't hear much now. So it's really great to know what's happening now and how the indigenous people in Hawaii culture and then also the recovery phase look like. So thank you so much.